So, good morning, everyone. My name is Adarsh, and today I am here to present my topic that is 16 arylidino steroid. That is a new class of the steroidal drug used in the Alzheimer and Parkinson disease. These are mainly I would talk about that how these drugs are novel and sorry again. So, good morning, everyone. My name is Adarsh, and today I'm here to present my topic that is 16 arylidino steroid. 16 arylidino steroid, that is a novel class of neuroprotective agent. So basically we use steroid molecule, but 16 arylidino steroid is a novel moiety that shows a potent activity. So that's why we are studying it here. And next, why the firstly we will talk about the why the neuroinflammation happens. Okay, so and what are the factors that are like basically influencing the neuroinflammation. So basically here we will say if there are infections, trauma and strokes and toxins, so it will increases encounter through the neuroinflammation because of the immune system. The next one is the Alzheimer disease. In Alzheimer disease, the amyloid beta and tau in neuroinflammation, these are activates. So the your tau proteins, there is a buildup of the beta 2, beta 242 plaque buildup, and tau becomes hyperpolarized, and that will lead to the memory and learning loss. In Parkinson disease, there are the chronic inflammation that activates the cytokinins, that is TNF alpha, interleukin 1 and interleukin 6. So it all activates the oxidative stress, and apoptosis will happen that leads to the memory loss. Okay, so next one is old age or autoimmunity and lifestyle disorder. If a poor diet, obesity and sleep, and gradually that all these promotes the neuroinflammation. If you are toxicity and neuro environmental stressors, so if you are working in somewhere where the pesticides or heavy metals are using, so these are basically decompose the protein aggregates and causes the neuroinflammation. So what is the mechanism of neuroinflammation in Alzheimer and Parkinson disease? So in Alzheimer's, okay, in Alzheimer's, the amyloid plaque and tau tangle hyperpolarization, as I told you, and leads to the memory decline, and inflammatory cytokines are also there. So increased neuroinflammatory mediators. So it in neuroinflammation, Parkinson disease, it increases the neuroinflammatory mediators, and which also increase the oxidative stress and leads to the apoptosis, that is neurodegeneration. So next we will study about the design and evaluation of the 16 arylidino steroids. Like what is 16 arylidino steroids? So this is the structure of 16 arylidino steroids, in which at the 16 position we have the CH and AR. This moiety is called the arylidine moiety. So 16 arylidino steroids we study about. So here firstly we will induce our rodents with the LPS, that is lipopolysaccharide, which is obtained from the gram negative bacteria. It is an endotoxin and leading to the neuroinflammation. Okay, so firstly we will induce the neuroinflammation by using the LPS. Okay, and after that we will test our drugs, that whether we will test our drugs. Okay, so 16, it is like the it is a derivative. It is a derivative of DHEA, dihydroependosterone and testosterone. That is the new class of the steroid, that is also called the heterosteroid. So it's because of it's showing the potent activity, that's why we are studying here. And one other analog, that is 4-AJA analog. In fourth position, if we introduce the AJA group, it also shows the potent activity in Alzheimer disease and Parkinson disease and multiple sclerosis. So how we are going to synthesize these drugs chemically? So firstly, the scheme 1 for the 16 arylidino steroids, this is the main scheme through which we can like synthesize the chemically synthesize the 16 arylidino steroids. So we have dihydroependosterone, that is the analog of testosterone, that is the most likely the testosterone analog. And when we use it, when we like react aldol condensation, base catalyzed aldol condensation of dihydroependosterone leads to the formation of the 16 arylidino steroids. Okay, so these are the aromatic rings we can put at these groups for the different molecules. Okay, so next one we are talking about the aja molecules. So these are the aja molecule scheme. How can we synthesize it? So we have a testosterone like moiety testosterone at the two compound. When we oxidize it with the KMNO4, it leads to the keto acid. Keto acid. Compound number three is a keto acid. So when we use this keto acid, so this ring will open. So now this ring we will use here the Leucard reaction. So with the Leucard reaction, a aja moiety will be introduced at the 4 position, and we will found the 4 aja steroid moiety. Now next we will introduce the Jones oxidation. So chromium trioxide and H2SO4 we will using here, and at the 15 degree centigrades the reaction will happen, and we will get the 4 aja androsterone. Okay, 4 aja androsterone, where we will do the cross aldol condensation. It will leads to the formation of the 16 arylidine steroid derivative. Okay, so these are the 16 arylidine steroid derivative. Next we will discuss that if the molecules, now we will how will discuss the results and biological activity. So discussion using the neuroprotective strategies. What are the neuroprotective strategies? Firstly, we will introduce the mice or rodent with the LPS induced neuroinflammation. So firstly, we will induce neuroinflammation with the use of the LPS, and we will try the drugs which is already marketed by the steroidal compounds. Then we secondly use the drug that are anti-inflammatory drug we have synthesized into the laboratory, and after that we will check the efficacy comparison. Next we will see that what are the efficacy comparison. We have escape latency, TSTQ, and percentage ITL. This is the one way ANOVA followed by Tukey's test. So escape latency mainly is the latency of a mice to explore the place. So if a mice is quite healthy, its brain memory is quite working well, so its escape latency will be low, so its latency is low. But when we introduce with the LPS, the escape latency becomes slow, because it leads more time to explore that place or recognize that place. So after that, the marketed that the celecoxib dexamethasone we will give, and it will try to restore to the control on normal. Okay, so it comes from 73 to 52 or 56. After that, we will see that here the escape latency graph and TSTQ and percentage ITL. These are the three graphs. So in percentage escape latency, when we induce it with LPS, it increases. But when we test our drug, the celecoxib and dexamethasone, so you can see the green and blue graphs become less, and percentage TQTS become more. So LPS TSTQ become low, and the TS percentage ITL become increased. Initially it leads more time, but when we induce with the drugs, so it becomes slow. Next compounds, we will test some other qualities, like some other tests like ambulation time, rearing time, percentage ITL, and catatonia scores. So these are the graphs. So ambulation times is the movement time, so rearing and percentage ITL becomes less. Degree of catatonia becomes more when we induce with the LPS, but the standard drug celecoxib and dexamethasone, and the standard drug we have synthesized 1C and 6C, so it becomes low. Next, the biochemical estimation of the brain supernatant. So here we have done a lot of tests like the biochemical assay and behavioral studies. So here the ACHA study, LPO study, and nitrile assay, and TSH assay, and SOD and catalyze assay. So all these data are stored here. So ACHA assay in acetylcholinesterase activity assay, we can see the control LPS, celecoxib, dexamethasone, and our best molecule, that is 1C and 6C, that has shown the activity. After that, the nitrile assay and SOD assay. So this TNF alpha become increases, when we introduce with the LPS and vehicle. So LPS significantly elevates the brain TNF level. So this is increases the TNF level in the brain. But when we induce the steroid derivative, so it are reducing the TNF alpha level. Compound 1C and 6A outperform standard. 4 as analog is the most effective. Okay. Next, in the docking studies, we can see the 2D interaction diagram of the co-crystalline ligand with 1C and 6C at active site of the TNF. So this is the TNF alpha active site, receptor active site, and steroid 1A to D जो molecule थे and 6A to H docked against the TNF alpha celecoxib dexamethasone serve as the reference. Docking validation by redocking and co-crystalline ligand binding site defined within 10 angstrom radius is the docking score. So our molecule has shown also very good activity. We can see this 1A to -6, but 1C has shown the -4 and 6C has -3. So these are the most potent drugs. So these are the references from where I have taken the data content and acknowledgement for the University Grant Commission, New Delhi, Research Fellowship, Scientist and Meritorious Student Scheme is grateful acknowledgement and collaborative chemistry, that is Punjab University and high tech formulation collaborative advancing chemistry. Thank you and question answer.